In regards to tests and vaccines, 68,509 tests were processed yesterday. There were 36,383 vaccines distributed through state-run clinics, many more than that distributed through primary care, and well over 90,000 vaccines distributed again in Victoria as Victorians come forward in increasing numbers to be vaccinated. We are now at 86.7% of the 16 years and over population who have had their first dose of COVID-19, and we are sitting at yesterday 59.8% of the Victorian community had had their second dose, so of 16 and over. So clearly we will pass into the 60% of the double-dosed Victorian community today. We do have a few announcements to make about the support of our healthcare workforce and the supplementation of that workforce that we did want to make this morning. We know that the next few months, as Victoria opens, are going to be incredibly challenging and difficult for our nurses, our midwives, our doctors, our paramedics, and in fact all of our healthcare workforce. We will see demand and challenges that our healthcare workforce has never seen before. As Victorians get back to the things they really want to do in a safe way, we will also be placing immense pressure on our healthcare workforce as they continue to care for a record number of patients in our hospitals and in our ambulance services. These Victorian frontline healthcare workers are the backbone of our COVID response, and we need to support them and recognise the support in every possible way as we help them to deliver the very best possible care when Victorians need it most. That's why today we'll be announcing a couple of things. Firstly, we're investing some $2.5 million to recruit up to 1,000 healthcare workers who are currently living overseas as part of a package designed to help to ease the pressure on our hard-working, hospital-facing staff dealing with COVID. This group will largely be made up of returning Australians who have wanted to come back in our healthcare workforce, but equally a large number of international recruits. These professional groups will cover nurses, doctors, midwives, and a range of allied healthcare professionals, and they will be recruited on the basis of the services and support that our hospital system needs. To be eligible for this program, eligible healthcare workers need to have an existing employment contract with a Victorian healthcare service and have the active professional registration in place and to be ready to travel. This announcement builds on the work that we have done in recent weeks, having facilitated the arrival of some 130 healthcare workers under the dedicated healthcare work pathways system that we've had in place since August, and this is the next logical step in making sure that we turn back on that international pipeline of support for our hospital system that has been on hold for the past 21 months. Today we'll also be announcing a record investment of some $255 million in support of those frontline hospital COVID-facing workforces that have been not only dealing with these demands for some months, but will now, as we move into a very, very busy period, having to deal with the surge that we will see in cases in our healthcare and hospital system. We will be establishing a new allowance to better support nurses, paramedics, doctors, and those hard-working people in those front-facing, hospital-based, COVID-facing environments that are really risky but really important, and as cases increase over the coming weeks, if not months, we want to make sure that a recognition of that is in place. So really, this unprecedented investment directly into those frontline carers and workforce healthcare professionals is in response to the unprecedented times that we're in. Really, the challenges that they are dealing with on all our behalf require this unprecedented response. So we will be introducing the new hospital surge support allowance, which will be paid to patient-facing healthcare workers, providing direct care in both our public hospital services and Ambulance Victoria over the next 4 months. Starting this week, the allowance will help ensure that these highly skilled staff in our public hospitals respond to the critical care that we know they will deliver, but making sure that staffing of our emergency departments is at least supported and recognised by this unprecedented investment. It's a small part of making sure that we continue to deliver world-class patient care whilst responding to the most difficult of operating circumstances that these hospital services will probably ever face. Workers in these roles will be eligible for a tiered allowance up to $60 per shift, and we see that as continuing on till the 10th of February 2022.